Hello, my name is Taylor Carmen, and I'm doing an assessment presentation for FCS 337 Methods of Nutritional Assessment. My patient was a 51-year-old female with diabetes. She's basically a stay at home mom. She doesn't exercise much and she doesn't work. She received a meal plan for diabetes from a registered dietitian, but she said that she doesn't follow the plan that often. Most of the times, she eat whatever her husband wants to eat that night or that day, and she also admits to consuming alcohol um, almost every day of the week. I did a dietary recall, 24-hour dietary recall for her. At 10 a.m., she had one chicken pot pie and half a cup of water. At 12 p.m., she had one bag of chips, a can of 7 Up, and one cup of water. At 7 p.m., she had two hot dogs on white loaf bread, a bag of chips, spinach dip, and one can 7 Up. Later on that evening, she also had two shots of alcohol. The dietary calculations for this day, she took in approximately 1,640 calories, and her needs are actually 1,819 calories for a day. She had 44 grams of protein that she took in that day, which is 11% of her total intake. She needs approximately 57 grams of protein daily. She had she took in 186 grams of carbohydrates, which is 45% of her total intake, and she took in 80 grams of fat, which is 44% of intake. Her biochemical data, her A1C1 was 5.2%, which is within the normal range. Her calcium levels was pretty kind of low. They were at 8.4 milligrams per deciliter. Her cholesterol was moderately high, which was about 218 milligrams per deciliter. And her HDLs were 110 milligrams per deciliter. Excuse me. Anything over 60 milligrams per deciliter is considered a negative risk factor. Her mean cell hemoglobin concentration was 31.4 grams per deciliter, which is considered low. Her anthropometric data, she is 5 feet 2 inches tall. She weighs about 186 pounds. Her tricep skin fold was 34 millimeters. And at 34 millimeters, this places her within the 95th percentile. Her mid-arm circumference was 34.5 centimeters, this places her within the 75th percentile. Her mid-arm muscle circumference was 23.8 centimeters, and this places her also in the 75th percentile. These values indicate that the patient is larger than most females in her age group. The clinical evaluation of the patient revealed she had normal brown skin. Her skin looked healthy. Her hair looked healthy. Her tongue and gums both looked healthy as well. There was no sign of callosis or papillary atrophy or angular stomatitis. Her skin was normal with normal signs of dryness. She appeared to have slight ankle edema. The assessment of the patient. The the patient is assessed and needs to add more fruits and vegetables to her diet, as well as dairy products. She also needs to increase her water intake, being that her water intake was extremely low for someone with of her size and age. She is consuming too many simple carbohydrates, and this definitely will not benefit her diabetes diagnosis. And also, consuming alcohol is affecting her diabetes diagnosis too. And the alcohol consumption needs to be consumed at a very minimum, if not any at all. Her A1C1 at 5.2% was in the normal range, and I'm thinking the medication that she's on from the doctor is what's keeping her A1C1 in normal range. Her calcium levels were low, and her high cholesterol and high density lipoproteins (HDL), those were high, and she had depressed mean cell hemoglobin concentration (MCHC) and above average anthropometrics. Medical nutrition therapy for the patient. Um, she should be on a diet that's around 1,820 calories a day. A diet consisting of 1.5 cups of fruit, 2.5 cups of vegetables, 6 ounces of grains, and 5 ounces of protein. And she should also be getting in 3 cups of milk or dairy products a day, and she can include 6 tablespoons of uh, healthy oils or fats. She needs 57 grams of protein, 4 small meals a day consisting of 450 calories each. And these meals should be spread out evenly throughout the day. It's recommended that she use whole grain products instead of refined grains. She should avoid simple carbohydrates, and she needs to consume 8 to 10 ounces of water a day. The patient is going to be referred to an exercise expert for an exercise plan that will benefit her in losing weight. And I'm also going to refer the patient to a therapist for alcohol substance abuse. The plan of action that I'm going to take: the patient will be educated on proper nutrition and the importance of maintaining a healthy lifestyle with diabetes. RT will also receive guidance on how to use the myplate.gov website to track and monitor her food intake. She will be encouraged to maintain visits with her exercise expert and therapist as long as she needs the support. The patient the patient's progression at home will be evaluated by follow-up appointments for at least 6 months. The follow-up appointments will consist of lab work and reviewing her lab work with her to make sure she understands her lab work and make sure that everything is improving. And after she's been seen once a month for at least 6 months, if everything is within normal range or acceptable range, after that the patient should be seen quarterly to make sure her goals are still being met. The patient will be asked questions to make sure that she understands all the information that is given to her, and she will also be allowed to ask questions if needed to. And that does conclude the slide. Thank you.